So now we're on to principle 5, which is still on reasonable adjustments. This time we're on the letter E in the word teach. So this is environment. Now, before I even start, I know you can't do a huge amount with your physical environment, but environment isn't just the building. Environment is the people, the other patients waiting, the images on your walls. It can be the paraphernalia in your environment, both clinical and otherwise. It can be the smells. So you really have to look holistically at the environment and what impact that may have. Now, there are lots of people with learning disabilities and autistic people who really struggle with clinical environments, and overcoming that barrier can be the difference between them getting healthcare and not. And sometimes that isn't overcomable, if that's a word. It's not actually achievable. So you may not be able to see them within your environment. And then it's about really thinking outside the box as to how you can achieve your service if they cannot come to you. We've got a GP that I know of who've, again, an autistic person who's got a learning disability as well, who really will not enter the GP practice, but loves being strapped into the minibus from the home he lives in. So he still goes to the GP practice for his appointments, but the GP comes out and does all his consultations within the minibus. There are plenty of people who may not be able to get from A to B within a hospital setting, for example, but can, if they're seen quickly, facilitate seeing the clinician within the actual room when they get there. So we've had situations, I know, for example, the specialist dental service, when it was based in the hospital, would have a fire door open where people could come roaring straight in and go straight into the clinical room. So it's really thinking outside the box. Again, final one from a GP practice was one, in fact, Gavin, you'll remember this.
Yeah.
Do you remember when we went to that GP surgery and we were waiting in the reception and we'd seen the guy in the car outside?
Yeah.
And he had headphones on, and he had his iPad on, didn't he?
Yeah.
And then when it was his time to see the GP, they rang through, didn't they, to the carer in the car, who hoiks him out the car, and he's run in through reception, carrying his iPad with his headphones on, and then as soon as he sees the GP, tucks his iPad under his arm and high-fives the GP at the clinical door, and then goes straight in.
Yeah, no.
And they've actually got that written up
Yeah.
as his accessible information and reasonable adjustments. Because if they go straight in the room, high-five and go through the door, he will accept treatment from the GP.
Yeah.
And if they don't do that, he won't accept it. So those sorts of things, aren't they, are really key for environment.
Yeah.
Now, as we said, environment can really impact how you present and what you're going to accept if you're getting anxious. Can you talk me through, I know we touched on it earlier, but can you talk me through again how it feels for you in a clinical environment when you're not sure what's going to happen and how you present?
I actually do really find hospital environments really challenging, and last year when I had to go to A&E, I found that really challenging. So it was in the evening, so it was after the learning disability nurses would be able to accompany me. So I was in A&E. It was really loud, really noisy. There was someone kicking off. Just the atmosphere, the smell, just everything was really, really, really difficult for me to go through. And I was there for a long time. And one of the things I remember in that was that I was there about my leg had blown up, a DVT, that's what they said it was. And then I'm waiting, I'm getting very overwhelmed, getting quite anxious. And then the nurse says, "Oh, could you come with me?" And she gets me to lay on the bed, and then she starts getting all these wires out and starts wiring me up. And I'm like, "What's this for?" And she said, "Oh, we need to check your heart." And I'm like, "Oh, okay." But I was getting really wound up and really worried because I was there about my leg. I don't know what they were looking at my heart about, and it was really challenging. And I think they felt that, because I wasn't answering questions, I was getting quite overwhelmed, I was crying at times, I was getting quite anxious.
Getting agitated and cross as well, yeah.
And I think they just felt that was my learning disability. They didn't actually see that actually that was me getting wound up, and that wasn't...
And you could be at the point of refusing to let them do stuff because of it.
Yeah.
And then, so it's about recognising then, and it's thinking, actually, is this person's behaviour anxiety and what can I do? So if she just simply said, talk to me, are you feeling anxious? What can I do to help you feel less anxious? You would have been able to respond.
Well, yeah,
you?
because then the next day I had to go back again, and this time I did have a learning disability nurse with me. And when I went there that time, and I was getting quite anxious and getting a bit wound up, the learning disability nurse was like, "Okay, Gavin's getting a little bit worried now. I think I'm just going to take him out and let him just calm down a bit and just just tell him a bit about what's going on." And we went and walked outside, and that really helped.
So it helped you come out of your...
Yeah.
You were sort of heading into that fight or flight mode, weren't you?
Yeah, boom!
Gavin, you do that to me every time. So that is exactly what fight or flight mode is, though, isn't it? We do this in training, so I didn't expect you to do that then. And that's exactly it. You know, instantly...
Yeah.
You jump, your heart rate starts going up and you go into panic mode, and then I can go, oh no, it's just Gavin playing a trick on me again, and I can come straight back out of fight or flight mode.
Yeah.
Now, if you've got a learning disability, you know, and you're in that environment and you're getting that panic on because there's all sorts of people and there's posters on the wall and there's equipment and there's all these things around you, and you can feel the panic building up, and you can't pull on your historical knowledge of going, oh, it's all right because all those people aren't anything to do with me being here, and that paraphernalia's got nothing to do with me being here, and oh, those posters and those people are nothing. You know, then you can pull yourself out. But if you can't, you just get more and more panicky, and then we go into survival mode, which is either start getting anxious, start displaying behaviours which everyone else finds challenging, and that's your way of communicating is, I'm scared, I don't know what's going on, help me out, I don't want to be here, isn't it? And that's what the learning disability nurse did, and then could take you out and go, right, Gav, come on, you can do this is why you need to do it, this is the importance. She can work with you on your capacity to understand why it's important to go through it before you get to the point of going, right, that's it, I'm going home, I don't care, isn't it?
Yeah.
You know, she can stop you, because that's fight or flight mode.
Yeah.
So it's really key for any health professional to be tuned in, whether it's verbal or non-verbal, to somebody's anxieties. And if they're displaying those anxieties, not go the shortcut of, I'm sorry, he won't accept it, take him home, but go, I'm sorry, we've got, you know, he's anxious, what can we do to help him come out of the fight or flight mode, calm down, and us to be able to still get the same healthcare for him as we would for anyone else.
Yeah.
And that's the key, isn't it, to doing that?